That's helpful. Not essential, but helpful. Come underneath the tibia and draw it forward, okay? So you can see that's a few millimeters of movement, but then it stops. And that should be pretty much it. Okay. Drawer testing, 90 degrees of flexion. I'm going to sit on your foot there, sir. Palpate the hamstring tendons, make sure they're loose. Make sure the femur and tibia are lined up. Pull it forward and should stop, okay? I'll do the posterior drawer while I'm here. Push it back. Show you guys the pivot shift, not essential test because it's very difficult for the patient to relax. So I'll usually just do the drawer and the Lockmans. The pivot shift, you can try it if you want or mess around with it. But usually the orthopods will do that, particularly when the patient's under anesthesia. Okay. Pivot shift, axial load. Internally rotate, valgus stress. This hand's going to go just below the fibular head. And what I'm going to see is a clunking back right about there. It'll sort of clunk back. Right here is where I'm looking. Okay? And the patient won't like it. They'll say that, oh, that feels bad. That feels like when my knee gives out. Okay? So that's why it's hard to do. It's hard to get them to relax. Particularly if they've had it done before, they're not going to want to do it.
I definitely don't like it. Now that I've been doing it a while, I don't like it on my thumb.
The other one for the PCL would be the sag sign. So 90 degrees of flexion, put both feet up on something, and then I'm looking down to see is the tibia sag back on the femur compared to the other side. Okay.
So I'll just use
Collateral ligaments.
form in the line of force and just drive that across.
Medial collateral ligament, 20 degrees of flexion. This hand on the femur and tibia. This one's palpating the joint line. I'm pushing into valgus. I'm also using my body to do it. Then do it down at 0 as well. Okay. Then for the LCL, just come inside the leg. Same thing, 20, and then 0. The thought with that is if it occurs at 20 but not 0, it might not be as severe of a tear. If it's really gapping at 0, then it's probably a bigger tear and maybe other ligaments involved. Okay.